We're about to talk about a most exciting time in your family's life, the day of discharge. First, though, a few words on what needs to happen before you take your child home, during what you might call the home stretch. As your child's condition stabilizes and you learn about providing day-to-day care, you will meet with your healthcare team to talk about what needs to be in place. There are several checklists to go over. By the way, you'll find all the checklists in a separate file on this DVD. You can access them on a computer. At the top of the list of things to check, your equipment.
We are very fortunate. We have respiratory companies who support our approach and our philosophy. So we have the luxury of having all the equipment tested 7 days in the hospital at the bedside before they're going home. And the plus about this, again, it goes back to safety, is this. If a child goes home and if there is a clinical change, we know it's not because, well, we know that's not because of the equipment. So we can then look for something else. And that helps us to make sure that all the equipments are ready to go for home care.
Of course, it isn't just that the equipment has to work. The equipment operators have to know what they're doing too. So at Children's LA, when the day of discharge is approaching, the parents have to provide 24 hours of continuous care independently.
That's the day when I always tease them. I say, the nurses love you to come in that day because the nurses will get paid and you do the work. So basically what we do is we would give them a room where the parents would do everything. So that's the time for integration. You put everything together, pretend that you are at home. And that many parents says that helps them to see what it is like to be at home, but in the safety net of the hospital setting and also with the nurses if you really need them.
So how will you and your healthcare team know when it's safe to go home? As your child's condition improves, your team will start to talk about setting a date for discharge. At Children's LA, the team holds a discharge planning conference with the parents to talk about all the pieces that are involved, including making sure your equipment is leased and tested, and arranging with an agency for nursing care at home. As far as the medical considerations, your child needs to be stable for 7 days.
I use the rule of 7 days rule. I feel like they have to be, there's no changes in the ventilator settings in all their treatments for the last 7 days, and they are stable. Of course, the doctors will also have to decide that their oxygenation is up to par and all the other medical issues under control. But that to me is a very simple rule to look at and make sure that there's no changes, no added treatment for the last 7 days.
During the last few days before discharge, your team will make sure you're up to speed on everything: equipment, medications, and home preparation.
Having the home prepared, having the equipment put away, the supplies put away before patient gets home. This is paramount because the day of discharge, we cannot be rummaging through boxes.
I like to take a lot of notes myself. If I'm going through the classes with Jiffy and everything that I learned with the nurses, I took a lot of notes. So the day before we went home, we actually checked every single piece of the equipment. I made sure that we had all the supplies we needed to go when we went home. I made sure that I called the agency so that the nurse can come here and meet us.
I want them to have all the medications the day before. Again, attention to those little details helps because then you're not holding up the discharge. All the medications that you get for home is ready and available. One of the things that I'm very adamant about is that there is no new learning on the day of discharge. Because I can imagine you present them with a piece of equipment and say, okay, well, this is a new feeding pump and go ahead and use it. No, we want to have everything touched, tested. In that way, then on the day of discharge, all I want you to do is to pick up your child and go.
Okay, the day of discharge has finally arrived.
Now, we don't advocate using an ambulance ride because, you're really going home. Your child should be in a very stable condition. So this is how we do it. We ask the home health nurse and the families to drive in the morning together so that the child will be cared for by a caregiver and a nurse at the back of the car. Then another safety feature is that we have the home respiratory therapists driving behind them as a safety precaution. And all these last 30 years, I have not heard of them needing to stop in the middle of a freeway. But it's something that we would continue to practice because it's safe.
The respiratory therapist came and drove with us home. When we finally went home and got home, I said, oh my God, this is really it. It's us here at home. And I remember that after the nurse left, she finished her shift, I said, oh my God, we're really by ourselves here. Are we going to be able to do it? I said, well, it should be simple. We did it at the hospital. It should be simple at home.
Well, that is the goal, to make home care easy, safe, and manageable. In the next chapter, we'll bring you some family-tested home care tips to help you succeed at your new normal.